Okay, hello. My name is Alan Friesen, Certified Employee Benefit Specialist. You might know me as the Chief Evangelist of the Caring Employers Healthy Teams Collaborative. With me is Miranda from Securcom Technologies, and remotely is Chris Craig from Securcom Technologies. Chris and I have known each other for a long time. Securcom does card access, video, alarm surveillance, alarm reporting. If you want to beam signals anywhere in the world, he knows how to do that stuff. You know, Chris, I was listening to that song the other day, Bible on the Bus by Corblend. Do you know it? And it says it's got parabolic laser beams, hear everything you say. You don't have that, do you?
No.
No, okay, good. Because that would probably be inappropriate to have that kind of a thing. So. But what we're doing today, I wanted to share with Chris. He's been a client of mine a long time. He has a Blue Cross program. That Blue Cross program, we looked at different options for a group of, there's 4 people on Securcom's group. So when you look at a group of 4 people, there's not a whole bunch of options with different insurers. And the rates aren't better and the coverages really aren't better. And if somebody gives you anything significant in pricing, you're concerned that they're going to try and get it back from you next year, right? So the difference here, well, let me ask you this, Chris, Miranda, if you're a group of 4 people or you're a group of 1,000 people, which one's going to get the better coverage, better value? Which do you think? The lowest rates?
Oh, the 1,000.
The 1,000. Which one's going to get the better coverage? The 1,000, right? So in essence, that's what we've done. We went to insurance companies. We went to 4 different insurance companies and said, here, we have 30 different companies here. Treat this as one big group, give them all better value, right? And give them lower rates, more coverage, and a 2-year rate guarantee. So that's exactly what we're working on. I'm sharing with you one option, and that's the option with Beneva, with the company Beneva. So there's Beneva and Cooperators are the 2 blocks that we're going to run. So we're going to have actually 2 blocks. So maybe the Cooperators might be better value. I just don't have the numbers for you, but I wanted to share with you what I do have because this is exciting like crazy. Okay. If you take, and I'll just show Miranda my calculations here, if you take the health coverage and you just take the health premiums and times them by 0.80, that's going to be your new health premium. If you take the dental premiums and times them by 0.885, that's the new dental premium. And then if you take all the lifelines, the life insurance, accidental death, dependent life, critical illness, long-term disability, and calculate those as a bunch, times that by 0.95, then that is your new premium. So basically your premium will change from $987 to $843. So it's a 15% reduction in your premium costs. Okay, so that's good.
For the same coverage?
For the better coverage. For the coverage I'm going to show you, it's going to be better than that. Okay. So that's the part I want to show you here. Okay. So we've had frustrations about needing the massage or the doctor's prescription for massage, right? That I know that's come up for you, right, Chris? Mm-hmm. So we eliminate that. Don't need a doctor's prescription for massage.
Nice.
Currently, you have a $400 maximum on chiropractor, physio, massage therapy, all those kind of things. Okay, instead of a $400 maximum, we're moving it to a $500 maximum. Okay.
Is there a limit based per treatment?
Per visit?
Yeah.
I do not believe so. Yeah, I don't think
just a $500. And is it per
practitioner?
Yes.
Yes. So each of those. So right now you have 400 for chiropractor. That's going to 500. You got 400 for physio. That's going to 500. 400 for all of them go up. Every one of those paramedical practitioners. So that's good news. So that's good news. The drug coverage is going to be the same. The travel coverage is going to be the same, except for Beneva's travel coverage is 90 days any one trip instead of 30, but still a $5 million maximum. Yes, and what else was I wanting to tell you here? Oh, yes. I know. The private MRIs are covered under the benefit plan. So let's say you need an MRI and you're on the 6-month wait to get it. You say, no, thank you. You book it with UT3, you go get it done, you pay for it and get it paid through your benefit program.
What's the coverage for
They
that?
don't actually have $1,000 maximum per calendar year. Okay. Yeah, and it's not just MRIs, but that's the most common one. They got MRIs, ultrasound, laboratory analysis, and ECGs. So there are other benefits besides that. But the MRI is one that people often wait like a year for an MRI, right? So they can speed that up. They also have coverage for TENS machines, transcutaneous electrical nerve stimulators, that isn't covered currently. Coverage for insulin pump, coverage for insulin pump supplies, those kind of things, and an out-of-province medical referral. So how that works is if you need to go and get services done, and you can get them done in Saskatchewan or BC, like, because then you don't have to wait so long, they have $10,000 to support that kind of an initiative. So again, it's kind of accessing care quicker is what it is, right? Yes. Now, also, your dental plan is with Blue Cross, is on this thing called the Alberta Blue Cross Dental Schedule. Now, that's unique to Blue Cross, and it's kind of a cost containment thing. Back in the day, they put it in when there was no dental fee guide, right? So, but now there is a dental fee guide again. The last time we looked at this and said to Blue Cross, hey, Blue Cross, how about you give us the usual and customary instead of the Alberta Blue Cross dental schedule? They said, sure, 16% increase in your rates. So instead of a 16% increase in your rates are going to go down 12.5%, and you're going to get that usual and customary coverage, right? That level. So it's the how much per service, right? Another thing that we ran across before, if you recall, is that people do not have the right income replacement. They're short on their disability coverage. So by our calculations, Chris is short about $1,100 a month. If he became disabled, he would be shorted about $1,100 a month on his short-term disability. And our other Chris is more than that, $1,791. He'd be short $1,791 a month on his disability coverage, and you would be short $1,100 as well. Now, those ones in the past, because you're a smaller group, you had smaller maximums and you had that smaller non-evidence limit. So they ask all kinds of medical questions, right? That could prevent you, even if it was something mild. Like they decline people for, oh, you've gone to a chiropractor before. No, we're not going to cover you. It's crazy. So anyways, the new plan has a $6,000 maximum and a $6,000 non-evidence limit. So you just get the values you need right away, no medical questions asked. So we're going to fix that disability coverage problem. We're going to take away the need for the doctor's prescription. We're going to enhance on the paramedical coverages, and enhance on the paramedical coverages. Oh, and then add the private MRI. So those are basically the coverage differences, and the rate would reduce 15%. And the rate's guaranteed for 2 years. Now you might say, oh my goodness, this is great value, but how are you going to be able to sustain this? Well, here's how we're going to be able to sustain it. Remember we talked about big groups versus small groups, right? The difference comes into how much admin the insurer builds into the rate. Your current Blue Cross plan has what's called a target loss ratio or break even, same thing, different terms, of 0.62. So that basically means they will allow you to claim, let's put it that way, 62 cents of every dollar you pay in claims, and they're going to keep 38 cents for every dollar you claim in administration. And that's a function of what group size you are. But now we're going to change that. Instead of it being 6.2 is how much you as a group can claim, we're going to make that go to 8.2, so 20% extra in terms of how much you can claim onto that plan. So that's kind of the sustainable long-term value that we can bring into play. So, and then the other thing we're going to do is to make it as, here's the downside, right? Benefit isn't as well known as Alberta Blue Cross, of course. But what we're going to do is get from you and Chris and the other Chris, of all your team members, we're going to get who their providers are, who they go to the dentist, who's their pharmacist, who's their chiropractor, who's their physiotherapist, and then we will arrange for those providers to have direct bill agreements with Beneva, so it's very convenient for you that way. So that's what we're going to be doing. Okay, Chris, what do you think? As your hair blown back, you say, wow, that's amazing. You're sitting there pretty
amazing. That's amazing, Alan. That's amazing, Alan.
Thank you, Chris. That's what I was looking for, buddy. I appreciate that. Okay. Are we going ahead for a July 1 effective date to make this happen for you?
I have a question.
Let's hear it.
You didn't mention anything about like eye coverage.
you currently don't have, well, you have eye exams,
Mhm.
but you don't have vision care, right?
Right.
So the eye exams, you also have it under this plan. I believe the maximum is just slightly higher. No, it basically says $100 maximum on eye exams, and I think your current one is 85, if I recall correctly.
I think it's 75.
75? Okay, so you're gonna have $100, so you're in the same place there. I didn't quote vision care. Vision care is an option. I'm not a big fan of vision care because with how much the premium you pay for it, for how much you get out of it, is kind of like so for value. But I mean, if Securcom wants it, it's certainly an option that we can. Why don't I get you the rates for it and you can consider it? Maybe you don't want to take the savings. Maybe you want to enhance the coverage by adding in. That's an option too.
Yeah, I was just curious. I mean, it's ultimately up to Chris.
Yeah, I'd be curious to see what that is too, because I mean, even just as a health improvement and health vitalization is getting your eyes checked every year, because apparently, I didn't know this, but there's a lot of health benefits from proactive health eye exams. Like you don't have to be wearing glasses just to have eye care, obviously, right? So, for me to go in once a year as around my birthday, to do my annual, checkup and all that stuff and get an eye exam done. I mean, I can't remember how much eye exams are, but if there's some kind of benefit there to use, that would it be ideal then?
Sure. Well, you got the eye exam you still have, no question. And the vision care is the amount towards glass or contact lenses. So that, why don't I rate that for you so you know what it is, right? You don't have to do it, but why don't I get the rates on that? The other thing, here's a fun fact for you too. You know how most of the time you get an eye exam, you go see an optometrist to do that, right? And they charge you $75 or $100 or whatever. I have found, I didn't know this before, but ophthalmologists who are opticians who can also do surgery and prescribe drugs, right? Ophthalmologists are all covered by Alberta Healthcare. I went to see an ophthalmologist. So I just basically called up Dr. Kwan, he's an ophthalmologist, and said, I want to come see you. And he said, come on in. So I didn't pay anything for that service, nor did my plan pay anything for that service. Alberta Healthcare paid for that service.
How old are you?
Okay.
Well, thank you for asking, but I'm 65 tomorrow, so I was before 65.
Okay, I was like, well, Alan, be careful.
Yeah.
Depends on your age.
Yeah. I went a year ago, so.
So you mentioned short-term disability. Is a long-term disability in there? Because I don't think we had short-term disability before, just the long-term and the accidental death thing.
The critical, no, just the other way, actually, Chris. You have long-term disability and not short-term. So basically, if you recall, you're relying on the EI, Employment Insurance Sick Leave benefit, if somebody is off for the first 4 months. And then, and actually that's been exchanged to 26 weeks now instead of 17 weeks. But the long-term disability is the part that we're kicking in, right? That you have, and we're saying let's enhance that so provides proper income replacement for you. And no medical questions, you just get it, period.
Yeah, exactly. And then there's accident death benefit or something like that we had before.
Yes. Yeah, you have $25,000 life insurance, $25,000 accidental death and dismemberment. You have dependent life insurance, so that's for family people and their spouse and kids. Then you have critical illness benefit, and critical illness benefit is $50,000, and it's payable if you get diagnosed with a serious medical illness. It's not, you might never still be working, but you can still claim that.
Now, do you have to survive for 30 days before you are paid that?
Yeah, that's common, that you have to survive the diagnosis 30 days. I've had really good success with that benefit. I paid out all kinds of claims for it. One gent, he never even stopped working. He was diagnosed with cancer. We paid him out the money. He made some change in his lifestyle, blah, blah, blah. And he's still working today. And we paid him that benefit 7 years ago or something. So it's been a long time. Good for him.
So bringing on 3 more employees, we may up that in some cases for the child, the death benefits and whatnot, and the life insurance. We might look at just going a little bit more on that too. I mean, that's been like that for, I don't know, 16 years or whatever we've been doing business together, right? So that we've never really changed that. But I mean, obviously the optical one is something we'll have to think about. If the exams are covered, that's great. So that's awesome. I mean, really, with the optical, it'd be more of a, I would think it would be more of a majority thing, right? So, but as we bring on 3 new employees, Miranda's going to be getting assistance, and we have a technician that just started his first day today, and we have another technician starting in about a month from now. So as we bring in these 3 new guys, then we'll obviously have some changes and whatnot. But at the same time, we might increase some of the coverages too.
Excellent. Yeah, let me get you some options together, but I'm really impressed with the value. And the other thing I'm going to get together for you is still an offer from cooperators as well. Remember, we're going to run 2 of these large account pools, so maybe the cooperators be even better value than this. Let's see.
Yeah.
So I do not have those numbers yet, but I will by the end of the week, and then I'll be back to.
Well, we're definitely excited moving forward with whatever best option you have for us, Alan. To be honest with you, you know, it's been great with you over all the years and whatnot. You know, Blue Cross has been great in a lot of ways, but you know, my biggest frustration, besides the major increase, especially this last one at 10%, where usually it's around 3-4% increase every year. It's just, yeah, I mean, it's just some of the rules that they have are a little bit behind, and I think even just the what do they call that, the pricing schedule? What do you?
Yeah.
Right?
Alberta Blue Cross dental schedule, is that the part you're talking about?
Yes. A little bit dated and behind as well. So, you know, but I think moving forward in a fresh new company and new opportunities would be great for us after all these years, for sure.
Excellent. And you know what also we want to do too? Obviously, you know, I've always helped Miranda in terms of keeping the plan running, but we want to make sure that this is at the team member level as well. So any Securcom team member can just send an email to my team at alanfriesen.com, and Scott, Alan, Kelvin, Sherry will get that resolved for you. One of our team members will respond to it. So you don't have to be on hold to you know, a 1-800 number in Toronto for like six hours. Contact us if you're having problems. We're going to get it fixed for you.
Right. Yes. No, that's perfect.
Okay. Thank you, sir, for spending the time, and we will get back to you.
Absolutely.
What? Oh my goodness, we got little notes. Oh, I see. This is Brother Scott. Brother Scott is, what's he say? With the CEHT collaborative, we can almost always save you money and get you better benefits. Yeah. 15% is going to be the common savings, and 2-year rate guarantee, and better coverages. That's going to be the common thing. Awesome. What does this say? We set up your providers and yes, this is the part I was just talking about. We're going to get who are your providers. We're going to go get them that they will direct bill you to keep your convenience at the same level that you've enjoyed with Blue Cross, because Blue Cross is certainly the most well-known in the province. But as we've identified, there's some things that they're a little behind on as well. So, okay, you set up your providers with your personalized billing option and save you time and convenience as a value-added service for the CEHT members. Beautiful. Thanks for putting that in there, Brother Scott. All right, so Chris, you're busy. You got stuff to do, people to see. So we will leave you to your day. Any other questions for me?
I'm good. Miranda?
No, I'm good.
All right. Keep yourself well. I'm going to get these other options laid out for you. If you're watching this and saying, hey, I want better value for my benefit program, call us. We can help you with this. I can just do the same rate calculation for you and coverage summary in like a very easy manner for you, a very convenient way. Keep yourself well. Thanks much. Bye.
You bet.